My name is Christy Moore, and I'm a physical therapist here in town in Missoula with Alpine Physical Therapy. And I have a certification in dance medicine that I received from New York City from some of the physical therapists who work with New York City Ballet, SAB, the NYU Tisch program. So I brought that back to Missoula and have been working with dancers for years now. And really enjoy working with that population. It's one of my favorite patient populations to work with in this town, because you guys are so motivated and you want to do well at what you do. So that's basically the brief history about me with dance stuff, but I've been a physical therapist for 20 years now, and this has been part of my favorite part of my career now that I've started doing this outreach. So I'm going to give it to Anna next. We'll just kind of go down the line, and then we're each going to introduce a topic. So the topic of this panel is Mythbusters. So we each have a topic we're going to talk a little bit about and then open it up to you guys.
Okay. My name is Anna Sulia, and I am a physical therapist. Work with Christy, and I came to dance medicine a little more just through some training. I received some stop Pilates rehabilitation training, and that went along with the idea of movement and what better population to try to teach to move better than dancers who have amazing kinesthetic awareness, but also maybe prone to some dysfunction. And so my foray into working with dancers was I set up a injury screening program with a ballet school in Eugene, Oregon. And then we'd go in once a month and kind of just help the dancers understand what injuries they shouldn't worry about, what things they could do to help their performance. And then through that work, I also worked with some of the company members, and then there's a modern graduate program at the University of Oregon. So I worked with some professional modern dancers in Oregon, and then moved back to my hometown, which is Missoula, and I've been helping Christy with some dance medicine outreach.
Thank you.
Hi, I'm Colleen O'Callahan, and I am a dancer many years ago with American Ballet Theater. I currently live in California. When I left American Ballet Theater, I moved to Utah, and my intention was not to teach, but that is what I ended up doing. At the same time, I did go to the University of Utah. While I was teaching at the University of Utah, they haven't had a big dance department. And so I was teaching, and then I decided, well, I might as well get a degree. And I couldn't pass math 50 even, so I decided I think I need to make up my own degree. And I loved psychology and physiology and anatomy and was fascinated by that. So basically, I studied the courses I wanted to study, and a lot of it was having to do with anatomy, physiology, and exercise physiology. I had some amazing innovators in the field of this dance medicine. Sally Fitt wrote a phenomenal book. And so my teaching's evolved. I've been teaching for about 35 years. I studied a lot of yoga. That brought in a lot of the principles that I now believe in, have helped me to reframe how I look at things, mostly. The way I watch is very different. Another thing I'm very interested in most recently is the Xenovermet floor bar technique. So I'm going to be getting my certification in that. But recently, well, several years ago, I found it kept coming back to this thing about standing in your truth. So that's what I'm going to talk about. Turnout, the myth of turnout. So I think I went on. Yeah.
Astrid Sherman, originally from South Africa, but currently in Canada. I run a big school in Vancouver. I'm a fellowship teacher with the ISTD, but my passion is in science. So I did go in Canada to SFU and did a degree in kinesiology, and I integrated it very much in my teaching practices. My school has a physiotherapist on site, Pilates studio on site, that all the students are screened at the beginning of the year so we can try and catch injuries before they happen. I'm also on the IADM, the International Association of Dance Medicine and Science, and on their education committee, hoping and trying to spread the word of dance science so us dancers can use all this fantastic information for training coming out that the sports people know and use, that us dancers should be using too, because we can benefit so much from all this knowledge that is out there.
Okay. This one back to you. So,
Am I going to start? Did you want Astrid to start?
yeah.
I'm going to have Astrid start.
Okay, so I'm talking about flexibility. So, the first myth I want to bust, or is it true? Do you have to be flexible to be a dancer? Do you have to be super flexible to be a dancer? So my honesty would say no. I have seen some spectacular dancers who are not very flexible, but they are superb artists. They have beautiful musicality, they're movers, they create a spell when you watch them. I feel that to be a dancer is not to be a gymnast. So that's my opinion. So it differs, everybody has their own opinion. Yes, super high legs can look spectacular, but once you've seen one développé behind an ear, you've been there, done that, seen that. Whereas an artist that comes onto the stage and can move with grace and coordination and musicality, that for me is a true dancer. So I don't think being flexible can make you a dancer. That said, you do need to have a minimum range of motion to be a professional dancer. So a professional dancer does need to show a good arabesque, and a good arabesque does need to be at least at 90 degrees. You do need to have développement à la seconde, a little bit higher than 90 degrees. So you do need a good range of motion. You do need turnout, and that range of motion comes from the hips. You do need that. But you do not need to be over mobile. You do not need to be super, super flexible. What's more important is strength. So strength is actually more important than flexibility. So when we look at who should be stretching, your very mobile, hypermobile student, who you will often find in a split, should not be in a split. They should be focusing on strengthening. Your very tight student perhaps should be doing a little bit more stretching, but as I go through some of the stretching information that's coming out, you'll see that stretching is actually should not be done too intensely, otherwise we risk injuring those very young, precious dancers and ruining their chances of a career by trying to give them more mobility. So what are we talking about when we talk about stretching? Let's first look at the myth of when to stretch. So when to stretch. Warm up. Stretching is not warm up. So often you'll come into a class and before class, and there all the dancers are sitting in à la seconde, in second position, and they're warming up. Stretching is not warming up. Warming up is getting your heart rate going, finding your range of motion, and range of motion literally is just getting your joints, all your joints moving. So we should get a bit of a sweat going, very light sweat, our heart rate going, moving all our joints, and perhaps then we can do a few static stretches. Static stretches is when you take a muscle and you pull it into a lengthened position and you hold it for no longer than 15 seconds before class. So anything over 15 seconds, you're going to take the risk of you lose power, you lose endurance, you lose proprioception where you are in space. So we don't want those, are all negatives. So there are lots of negatives with stretching. We want range of motion though. Then our bar, especially for ballet dancers, our bar is actually stretching. All our grand battements, our développés, those are ballistic and moving dynamic stretches that are actually stretching our muscles, but we're doing them with coordination, we're doing them with music, we're doing them with dance, so they're dance specific. They're in our class already, okay? After class and after all the rehearsals, you can perhaps do a little bit more stretching. Stretching is also quite good for your mind and soul. It's relaxing. And there, after your class, after your whole day, you can do slightly longer stretches if you need them. So if you're one of those very super mobile dancers, you should not be doing more stretches. But if you are a tighter dancer, you can do more stretches at the end of your day, and here again, no longer than 30 seconds. So those stretches where you see dancers, for minutes, maybe 5 minutes. I've seen girls, reading books in very strange positions. You are sitting into the hip capsules, into the joint capsules, you're destroying some of the ligaments, you're setting up yourself for injuries down the lane. So in older age, you're going to have injuries that creep in that you should never have, but you've damaged some of your ligament and your joint capsules. Very interesting study done on the Royal Ballet. They looked at the percentage of hypermobile, so very, very flexible young dancers, and then the percentage of soloists and principal dancers later on. And they found that there were hardly any hypermobile dancers left in the higher ranks. Because in your 20s, those injuries, those your ligaments and your capsules are your strength and your stability. So when those are damaged, the injuries start coming out. And so those very hypermobile dancers do not have long careers, the injuries start catching up with you. So if those hypermobile dancers are more encouraged to strengthen, we could avoid that. So we've looked at when to stretch. The other thing is if for tight dancers, if you do your stretching after class when your muscles are warm, they've found, studies have shown that stretch will stay longer. So that's another thing about stretching. You ask a tight dancer, they'll stretch, they'll go for their stretch, and then the next day they feel tighter. And then they'll stretch again, and then they feel tighter and tighter. So they found that if you time your stretches, that you're doing those slightly longer stretches for the tighter dancer only after class, at the end of your day when your muscles are very warm, that the gain in flexibility you get is maintained longer. So never before class, never when you're cold. And here's the kicker. Do you know that you only have to stretch once a week to maintain flexibility? And to us dancers, we're like, what? Once a week, and you'll maintain the flexibility you have. That said, dancers like to have a little bit more range of motion than normal people, so 3 to 5 times a week is adequate. Okay, and of that 3 to 5 times a week, your static stretches is your safest way of increasing your flexibility. 3 to 5 sets of 30 seconds. That's it. Okay. So, and that's after your class, after your rehearsal. Before your class, never hold a stretch longer than 15 seconds. You're just wanting to work through, once you've got your heart rate going, you're wanting to work through your range of motion, getting all your joints oiled up, I like to say, ready for your class. Your class work is, a ballet class is brilliant. Développés, grand battements, think about all those movements we do that are taking our body through its range of motion. And we're learning it with musicality, with control, with strength, with technique. There's nothing better than ballet class, actually. So, one more myth. No pain, no gain when it comes to stretching. So a very tight child will, you're tight. You can feel that stretch. The rule of thumb is 8 out of 10. So yes, you're taking your muscle to the point, this is a static stretch, 15 seconds before, 30 seconds afterwards, no prolonged stretches. You're taking that muscle to that point, 8 out of 10. And 8 out of 10 is usually, it's before the shaking starts. So, yes, you can feel it, but it's not that sharp owl pain. That's safe stretching. Please remember, stretching is so individual. So when you're teaching a class of students, every child is going to need a different eye, because every single body sitting here in the audience has a unique set of joints and a unique set of muscles, so it really needs good guidance from the teacher. Stretching can be incredibly dangerous. So those were my myths. Does anybody have any questions for me?
Question. I have a question. When you're a teacher and you have students that were taught by others and they were taught the other way of stretching, what's the best way to, without making the other teachers look like they're wrong, give the information in a way that will be well accepted?
That's a hard one.
Yeah.
Especially because, you look at what you can find on YouTube. Even if you think of ballet, you look at the Vagonova videos from Russia, but those kids are picked from, those kids are selected by X-ray. They out of thousands. So you have these perfect little bodies that they're showing this system and syllabus on. You can't apply that to Joe Soap's School of Dance, So, and that's hard in this age of YouTube and Instagram to explain to students that that doesn't work for their body. You can but just try. You have to do it very gently. A good way is saying that I love that study that came out of the Royal Ballet. That's a beautiful way of saying it. Look what's happening. The research and the science is not showing that dancers who are hypermobile are making it. That's a good one. The other thing is, if you look, I don't know other teachers, but I find that the students who are very hypermobile are often not very coordinated. It's a struggle to get them to be dancers because they're not coordinated. But it's hard work. We fight as much, as glorious as the internet is, and the information that you can have at a touch of a finger. It's very hard because there's so much. I've seen videos by 14-year-olds showing you how to do oversplits. Oversplits is just an absolute no for anyone. Anytime that you're putting weight and gravity into a stretch, your joints are so, your capsule, you're just putting yourself at such risk. It's not necessary. So there's some stretches that are just not necessary.
Thank you.
Okay, unless you want to go join the circus. That's another way of saying, do you want to dance, or are you looking to join the circus?
Astrid, also, the latest craze is to do a split with the leg up on a chair. And that's the most dangerous thing I've ever seen.
Absolutely, absolutely. So the problem with that is when you put any, it's even worse when it's on two chairs.
Yeah. Between it.
So you're taking your bone and you're hitting bone on bone because you're hitting the top part of your hip capsule. So the amount of, this was another very interesting fact at the latest IADAMS meeting, was that the physios there is such a sharp incline in labral tears and not in professional dances. So usually those very severe injuries, we used to see them mostly in professional dancers. We're now seeing them in 8 and 9-year-olds. So labral tears in 8 and 9-year-olds, which was, you never ever saw that. And it's because of those kind of stretches that the young kids are attempting. You know, anytime you can grab your leg and pull it over, that image that was up, those, and sadly the competitions are encouraging that, because some of those lots of competitions, because those kids are winning awards. So it takes a very compassionate, caring, knowledgeable teacher to encourage, but not force, and teach safely. I mean, it's a hard one, and stretching is very controversial, the science is still just starting. Everybody didn't want to touch stretching because the science was so not there. The science is now coming in, and it's a tough one to teach to your kids, because yes, we do need to have good range of motion, and we do celebrate flexible students. So how do we balance that with science?
So Melissa, one of the best dancers in the country today is Tyler Peck, and she never gets her leg much over 90. So you can show her a video of Tyler Peck.
Thanks. That's beautiful. Yeah.
Yeah.
I mean, if I think back to the dances that I thought were beautiful, Sylvie Guillaume was never my favorite. She wasn't. You know, it was wow to watch her once, but now, you know, been there, done that.
And the well dies after a couple times.
Anybody else?
Are there any regulatory committees for these competitive arenas where these dancers are coming in at such a young age and their bodies are being destroyed?
No.
No?
No. There's a lot of hope that the universities are doing a great job. A lot more young teachers coming out having a university degree in dance. So there's a lot more knowledge coming out. IADAMS is working hard to try and get that knowledge out there. Physios are specializing in dance science. So it's starting. A great example actually is if you look at football.
Right.
So concussions. There was all that, all the players getting concussions. Apparently one of the top schools in the US who used to have like 6 football teams in their grade 12 year, they now don't have enough players to make one, because parents aren't putting their kids in football at school anymore. So but it took 20 years for that to happen. I mean, we don't want parents not to put their kids in dance, but we want them to come and not do anything during their training that's going to be detrimental in their older age. So.
It's not really even the older age, it's detrimental to the time they're 12.
Oh,
Well, that's the sad thing is some of, you know, now with those terrible injuries you see in the young kids. What's going to happen to them when they're 20, let alone 50, you know? So, yeah. I mean, dancers, the standards achieved in dance have increased incredibly. Young kids, we're making young kids do things that we never did. Should we? Is a question. Just because they can, should they? So, a question for all teachers.
Great, thank you. Okay, hi. Come on, dancers, you're gonna get up and come on here. I just decided we're gonna do this a little different. So, but you wanna take off your tights, your pants, so, and then we're gonna just increase your turnout, right? So you're gonna come out here and lie down on the floor. Lie down on your back with your knees bent, all of you. Come on, especially if you want more turnout, because by the end of this exercise you're gonna do, I'm gonna promise you're gonna have more turnout. So you would like a lot of turnout, wouldn't you? Oh, really? That's, okay. All right, lie down on your backs. Let's see how much turnout we got. Well, do the upside down frog for me. This is the one we're not supposed to do. Just let's see, so you can test your own turnout. Lay down on your belly. Bring your heels together with your knees out to the side. All right, okay. Kind of look around here, you guys, because we're going to see if there's any differences after we do this little exercise. So we got a lot of rotation. We got mostly rotation. We got somebody that wants more rotation right there. We're fine. Somebody wants rotation right there. You know how to do correctly because she's got her toes higher than her heels. This one knows what she's doing. That's correctly too. Put the heels together. All right, anybody else out there that's checking to come on out? What about? No? Okay, good. It's fine. All right, now sit up. Sit down on your sit bones. You know where your sit bones are? Please tell me you know where your sit bones are. Put your heels in line with your sit bones. Bend your knees, put your heels in line with your sit bones. Okay? Bend your knees. There, these are your sit bones. Sitting right up on those sit bones. Right? Yeah? Roll back to make sure you can feel those sit bones. Roll back. Put your hands on your top of your back here. So hold on. Now come on up. You feel little boom booms. You feel little boom booms? Yes or no? Those are your sits bones. Go back again on your boom booms. And come back up on your boom booms. Sits bones. Guess what's attached to your sit bones? Anybody know? Your rotators. Your rotators. Rotators. Guess what they do? Turn out. Yes, they turn out. So when teachers say turn out from your hips, and they do this with the tongue, it's rotators. You have 6 little outward rotators, and they turn out your legs, right? Right. Am I right, physical therapist? Am I okay? Okay. So you've got to engage that in order for the thigh bone to turn out, okay? The head of the femurs of all, it was whoop, in order for it to turn out. Now, let's see. Let's do the exercise. Lie down on your back. Elsie Kirkland taught me this. Too bad if you don't know who she is. Bend your knees, heels flat on the floor. Heels in line with your sit bones. Bend your knees. That would be your knees. Bend those knees. Press down with your palms flat on the floor. Good. A little closer. Hips aren't that wide. Press down with your feet flat. Inhale, lift your hips up. Good. Don't let your knees come any closer together. Pretend like you're holding that. That's it. Now, clasp the hands underneath you. Like this. Clasp the hands. Place your hands together. Clasp them. Interlace your fingers and roll your shoulders under one at a time. Hold that for me. Bring your feet together. Heels in line with your hips. Not that right. There we go. Here we go. Is this Julia? Okay, I'm going to lift your, there you go. And watch what I'm going to do. I'm going to turn her thigh bones in. Turn sideways, Julia, so we can see you. Hips up, good. Heels close, good. Go on. Now watch what happens. I'm going to take her thigh bones. I'm going to turn inward. Yeah, there we go. Yeah, use that. Then she's opening from her heart. Now you turn in to turn out. Here. Ah, that's it. Now she's going through her upper back. She's not going to give it tension in the lower back. Now, I'm going to demonstrate with her the exercise. Bring our feet together. Squeeze my hand. Hips up. Ah, squeeze my hand. Hips up. Ah, squeeze my hand. Hips up. Ah. See what I'm doing? Do that with each other, okay? Get a partner, do it. Keep those feet. Now, all right. All right, lie down. Heels flat. I'll pick you. Good. Keep your knees bent. You're okay. All right. Clasp your hands, interlace the fingers. Roll the shoulders underneath you. There you go. Rotate your thigh bones inward. Yes. Heels in line with your sit bones. Squeeze my hand. Hips up. Squeeze my hand. Squeeze. Hips up. Good. Good. What? Oh, she's doing fine. She's fine. She good. She knows what she's doing. Yeah, it's good. Okay. Now, come down, see if you have any more turnout. That's only half the combination. See if you feel any different. Open, do what you did before and see if there feels any different than trade partners. That was only half the exercise. Yes or no? Trade to the other side. Change partners. heels got to be in line with the knees. There, and feet. Take your toes out a little bit. Hips up. Toes out, hips up. Heels out, just a little. Hips up. Toes out a little, hips up. Heels out a little, hips up. Now crab back in, out, back in, and hips up. So it's the crab walk. In and out. You feel that in the back of your legs? This is too much. It's extreme, extreme, extreme. And then back. See, here. Toes out. Not too much, hips up. Heels out. Okay. See, we're all losing the awareness in the inner legs. You cannot turn out correctly. You cannot use the back of your legs correctly if you do not turn into parallel. All right? There's no way. We're all this. Right? So, stand up, everybody. Come on. First position. Your toes. Can you show me your feet tights? Or your legs. Your toes, come over here, have to be looking at your knees. If your toes are not looking at your knees, watch. See this one, toes not looking at her knees. So she's not going to use as much of this. She's going to roll. She's not going to use the back of her legs. Engage the turnout right here. This is going to be overdeveloped because this isn't working enough. Go back to sixth position. Bring your sit bones toward one another, lift up. You want to think of your top of your thigh bones turn in to turn out, turn in to turn out, turn in to turn out. You guys are the experts. Am I okay so far? So it's about bringing balance into your body. If your car is out of balance, it gets sick. If your house is out of balance, it falls over, right? So, in order to turn out, I'm not even asking you to go back on your heels and open your toes. I'm asking you to slide your toes to there first. Just narrow as possible it can be. Now, bounce the heels. Bounce. Good. And then feel like somebody's taking two. Here. Good. There. Good. Take that off. Good. Lift this. There. So your top of your thigh bones are turning in to turn out, turn in to turn out, turn in to turn out. This thing right here, this is the only one I'm not sure what to do with when we have not knees. That's about the only thing I can't figure out with dancers. It's a little hard, but this doesn't matter because it's so darn cute. It's really not bad, right? and here. But, so, you feel the back of your legs working? That's where it's. Now, let's see your fifth positions. Are yours? Okay, oh, this is a good one. Here we go. Everybody sit down. This is the one I want to work on. This is, I got it. Here she is. I love her. And this is how most people go into fifth. Go to fifth. Big sheet. Big sheet. Big sheet. Right. When you bend your ankle, the knee bends more. When you bend your knee more, your hip turns out more. Hop. So people go like this. Watch your teachers. They go, ah! And this is bent, butt's out, and the thighs are too big, and the inner thighs don't work. But I'm in fifth, right? Now watch. You go like this. Tanu, ba-ba. Tanu, ba-ba. Tanu, ba-ba. Tanu, ba-ba. You have to watch from, you have to watch like an x-ray. I told you this, right? This, where I learned this is yoga. When I had to stand in parallel for the first time in my life, I cried. Tears coming down. Tears. Changed my life. If I had learned how to stand in parallel, I would have not had 3 new hips. Okay, I've just had my 3rd hip replacement, November 16th. Okay, so now, you straighten the inner to the outer, boom, and you turn out. What do you want to do? You want to show turn out when you dance, right? There, that's turned out. Go, go, go. Go back to 6. Okay, now the next thing I do is this. Put your hands here, bend your elbows. Armpit, chest, in front of your hip. It's like shift forward on the ball's feet. Nope, I didn't say turn out your feet. I said shift forward on the ball's feet. That's it. Good. Quads lifted. Shift back in the heels. And I don't make people buckle their knees anymore like I used to, because if their weight's where it needs to be, they can really pull this up without buckling and still create length. Now, slide the feet to first. There and best. Yes. No, don't. Bad foot. Just because you move your foot change where your thigh bone is. You move your foot, you go on stage like this. Now they're there, and then they go, your little girl today, Charlene, which was her, and she was there, and she did this one, right? Was that yours? Perfect. Didn't move that standing leg. Brilliant. Brilliant. Didn't she? I am so against this standing and then all of a sudden standing, changing the foot you're standing on. You cannot. Right? Okay, so shift forward, shift back, slide the toes, wrap, lengthen. Now, this is gonna work. So when I was working with her, and she was like this, overdeveloped, not working. You go here, you turn in to turn, lift up the heart and turn out. So you're working here. How many of you realize the back of your hamstrings and the back of your legs need to be stronger than your quads, right? So all of those exercises. But then what are you going to do? You're going to go like this. So you know what? You do exercises to get this turn on before you start class. Turning things on so that when you start class, it's turned on, you're ready to go. Then work from third position to start. So let's stand up. Shift forward. Let the quads lift. Hip bones lifted, hollow lower belly. Shift way back. Yes, now pull up the quads, feel the back legs. Now slide the toes. Not weight back in the heels. Don't let your ego get involved and tell you to how far are my toes. When you're on stage, you're going to be going like this. I saw a lot of this today, right? Because we try and stand like this. So you don't develop any what? Strength. You don't develop the strength to hold it, right? Toes have to look at your, now slide to third. Shift your weight forward. Shift your weight back. Find the center, right through the center of your pelvic floor. For women, it's like stepping over. Women, it's like trying to stop yourself from peeing. And for men, it's like stepping into a pool of cold water. That's where the lift is coming from. Everything up. Now, Tanya through the foot front. And close back to third. Bring the back of the leg you're standing on to meet the front leg. That's it. Tanya front. That's rotated. Beautiful. And close. That. There. You feel that? That's working your turnout. So this is a little hyperextended. We don't have time to go into that today. So she just needs more strength in the hamstring back here in the back of this leg, but she'll be able to fully pull out that leg. Okay, so here's one. Now here's the next thing we're going to do. This is just recently, I've been working with someone, I couldn't believe this because I've been doing it, I think, wrong my whole entire life. And that is coup de pied. Do coup de pied, everybody. Come onto the ball of your foot. That's it. Now. But we want to do that, right? No, you want your inner legs to work, so watch. I'm here to feel, there. Push that there. So it's the relationship between both hips that are going to help you step. Boom. That's right. Go on, coup de pied. Oh, don't lose that without sickling. Now, how do you not sickle? If you're sinking down in this standing leg, then you're going to be doing this by doing what I'm asking you to do. If you get way on top of that leg, then you can keep that heel attached as it's coming up to retirate. Go. Yes. See, already, I'm out here, let's use this beautiful example. Go, do what you were doing. So there's not a relationship between these two hips, right? See this big distance? That's not turned out. This hip is not connected to this hip. So come onto the ball of your foot. Okay, gripping toes. Bring your toes in. It all depends on where you're standing. Bring your toes forward. No, toes. Toes. Yes, a bit more. Now turn out your leg. Now look. You see the difference? So you get this. Yes? You feeling this working now? Okay. Coup de pied. She also gets a little back in that shin bone because she's back in her heels, so the heel's going to be pulling away from like that. But coming back without signaling, she had to get on top of that leg. Okay, good, come down. So we've got to change one thing. Change how you are Standing. How you're standing. Are you standing in your truth? Where's your truth of your turnout? Where's the truth? Then you work from that place and you get stronger and stronger and stronger. And this exercise that we didn't all finish, so you went like this, toes out, hips up, heels up, hips up, toes out, hips up, heels up, hips up. In, up, 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 up. Then once you're there, you write your name with your sacred. C-O-L-L-E-E-N. You start writing your name with your sacred. And you're strengthening up the back of the legs and all these muscles. So that when you stand up, they're turned on, they're working, and when you do something, it's totally with the intention of turnout. And that's the second word that I think is so important, is intention. You intend to turn out, we see it. Not just turn out. You intend to point your foot, we see it. So if it comes from an intention, not because you're so flexible, you're this or that, but what's the intention? And then what does that mean? Artistry. Now, for you, this is happening a lot, which is dancing. And I know the one thing, here's what I thought. I gotta get my hands on her because she's doing this because her weight's too far back. Her weight's too far back because she's not standing in her truth on a regular basis. Hyperextending legs, not working through the inner thighs. As soon as she gets on top of those legs, doesn't get the weight pulled back far behind her, her chin is going to be right where it needs to be, and you'll win every competition you go to. Okay? I mean, in my opinion, you're beautiful, but this is pulling you back, and it's because of how you're standing. So every single correction you get, as far as I'm concerned, tension in your hands, tension in your elbows, tension in your neck. You're not spotty. It comes because how are you standing? Look at Gene Kelly last night. Did he dance with fluidity? Personally, I think his hands are a little stiff. Not sure about that yet. But not so much in the piece that he did with the Martha Graham thing. There's been the kids. His hands were a little more fluid in that. But it's because he was standing in his truth. There was pure honesty. So he could be completely authentic and real in what he was showing. Does that make sense? So frappes. This is a really good one to be on top of your leg. Push the outer edge of your back heel. Nope, right into that bump. Make it touch. Yes, and you're working this. Okay, now coup de pied back. That first little group today that did that little, so adorable because every time they did coup de pied back, their outer edge of their back heel was touching and they were turned out. It was beautiful. Boom. Da, 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 da. Press the outer edge, bend your knee, and press that into it. Good. Yes. So with that releve, if you keep that heel attached, you'll be right there. You can do the whole thing. Releve, boom, ba, ba. Nope. We're going to come back to heel in. So your intention is pull the heel in and make it touch. Out. Go side, bring it front. Nope. This heel comes to there. Up, up. Nope. We do, that's the knee doing the work. You don't want the knee to do the work. Okay, I think I'm out of time. Okay? All right. That's all. Any questions? Okay. Is that okay?
No,
All right.
fantastic.
Great. I love this stuff. I'm passionate about it. And I get a little over the top, but it's because I've been doing it for a long time. And I think everybody that has a chance to see it can change their own dancing and be so much happier. All right.
For me, standing in a perfect fit, like being overstretched, doesn't make a dance.
Okay.
Okay. So we're going to just run through quickly a couple things from our end. My myth has largely been addressed, so I'll just add a couple of my thoughts. No, it's awesome. That's why we have these amazing people, and I think as a physical therapist, I think it's wonderful that we have people running schools and teaching our young dancers these principles because they're fighting against a lot of YouTube and other expectations, and like you said, I think there's, I said at the beginning, I love movement, and that's why I love dance. I think it's amazing what dancers can do with their bodies. It's beautiful to watch, and I would agree, the ones that look strong and fluid, it's not about like throwing your leg up in the air, it's kind of like how many other, you know, huge extensions on your right leg can you do? Can you do that on your left leg? Can you stand on your right leg? These are the things I think about when I watch dance. And so my myth is to become a better dancer, all you have to do is dance. And I think that probably we can all agree, based on just the demonstration Colleen just gave us, that's not true. And so just some ideas about what is cross-training for a dancer. And that might be things that help your flexibility, but flexibility, touching on what Astrid said, I would say the more that we learn about mobility and how it relates to our nervous system, your flexibility may not be where you want it to be, but it might largely be because your body isn't letting you have that, and it may be largely in compensation for stability somewhere else. So that starts to come to what Colleen is saying. It's your core. You don't understand where your neutral is. You don't understand how to engage your pelvic floor. Somebody told you that, and you said, okay. And I see a lot of people pinch their butt cheeks together, and that's not your pelvic floor. So, so learning where those things are, and in a group setting, that's hard because these instructors are doing a beautiful job telling you all these wonderful cues, and there are more progressive cues than things that we've probably heard from some of our students, but that doesn't necessarily make sense to you as an individual dancer. And so I think that's maybe where some of the stuff Christy's going to talk about is where we can come into play, because we can help you understand what that individual truth is for you. In season, cross-training might need to be something along the lines of restorative movement, like yoga or Pilates practice, something that gets you out of your common places. We turn out all the time in ballet, so what that leads to, and what Colleen's showing you in that exercise is, say turn in to turn out, because we overutilize those rotators. They get short and stiff, and as a result of that, they get weak. They can't do their job. We overutilize muscles, and that's how we get overuse injuries like Achilles sprains, plantar fasciitis, and tendonitis. And so finding some ways to offload the body and do something different in dance that also might help our cardiovascular system, so that at the end of our performance we're not huffing and puffing and falling out of our pirouettes, or our jumps have not come as high and we don't land with as much grace. So making sure that system is up to par. And dance does a lot of that, but maybe not quite enough, depending on where you are and what you're doing. So some ideas, swimming, or get in the gym, lift some weights, especially if you're a male dancer. You have to lift, not huge people, but you're lifting people over your head pretty frequently, and that's actually kind of hard. So making sure you have the upper body strength. Same for women. You need endurance to hold yourself arms overhead for 5 minutes is actually kind of hard. Doing, modern, if you're into modern and you're coming down on the floor and you're having to stabilize through an arm, or you need strength to do that. And I think that's what both these ladies are talking about. And so that kind of leads us into what Christy's going to say. And then we'll maybe open it up. If anyone has questions for us, we'll just open it up after she speaks.
So one myth that I wanted to address, and this is just because I've heard this before, interestingly, because I've been in a lot of different settings and outreaches for dance, is that there's a conception that what a physical therapist is going to tell you to do is to rest and to ice something. Like that's how you're going to take care of all of your injuries. And in my opinion, and how I treat dancers, this couldn't be farther from the truth than what a physical therapist does. If a physical therapist does that, I would say maybe you need to shop around for another physical therapist, because that's truly not what they should be doing. I see physical therapy as having many roles with dancers, and what I'd like to see ideally, and it sounds like Astrid has this at her studio, and Anna has done this in the past with Eugene Ballet, is screenings. Taking a look at each individual dancer before you have an injury, and looking at your true range of motion, looking at your strength and the balance and strength between your hip internal and external rotation, looking at strength between hamstrings and quads, knowing where you need to work to be a better dancer, knowing what will help you. You may be able to get better true turnout, not turnout that you're forcing, if you know what's restricting it. Is it truly that your joint can't move that far? Well, then no, you're not going to stress the ligaments, and you're not going to stress the tissues that are going to cause permanent damage possibly later on, but you're going to learn how to work within what your body can. If you don't have it assessed, you're just trying to do what's being told in class, and sometimes trying maybe not in the best way. Sometimes, you know, people adhere to what they feel and they listen to it, but I would say in kids, not so often. That's really hard. And because you're trying to achieve this beautiful goal of movement that does require a large range of motion, if you know where your maybe sticking points are, then you know what you need to do to address those, or some of the things that maybe you actually can't change, but you can work around that with almost anything in dance, whether you are the stiffer person with dance who has to work to get a little bit more flexibility, or if you're the hyper flexible person who needs to know how to have the strength to control that extreme ranges of motion. So screening is a great place. Like, I feel like that would be my favorite place, is preventative for dancers. I love to go and give talks at dance studios, and we work with the university dancers here, you know, educating them about what it is to prevent an injury, what it is you need to do to strengthen the right muscles to get turnout, to get yourself off the floor if you're a modern dancer. Like, what do you need to do to make yourself be the best dancer that you can be? That being said, I would say the majority of dancers' first introduction into PT is because they're injured. So that does happen. It's, you know, it happens to all athletes, football players, soccer players, dancers, anyone who is pushing their body to limits and testing it and continuing to keep working through things, there's a chance that there's going to be an injury. And my advice there is the quicker the better that you get in to get it taken care of. It will just take less time. It will get better quicker. And we don't tell you to stop dancing. We had a conversation a little bit before this that just because you have an ankle sprain, that doesn't mean you can't do anything in dance class and you can't do anything. We are there to help guide you in what is safe to do, that's okay, that's going to allow those tissues to heal, but yet keeps you moving and keeps you working towards getting stronger so that you can get back as soon as possible. So if you have an injury, that's where we come into play from that perspective. You know, I think that there's sometimes some misconceptions about that, you know, if you go to PT, it's one visit and you're going to be better. You know, that's kind of a fallacy as well as trying to make a change in what you're doing with dancing. You know, we give you specific things to work on. We understand that you have busy lives and you guys spend so much time in school and dance and everything else that you're doing. I'd like to think that dancers that or PTs who work with dancers have that understanding where we're not going to give you 35 exercises that you need to do every single day, because that's not the reality. A working mom is not going to do 35 exercises every day. So, you know, looking at the reality of what is specific and what do you really need the most of to help you be able to recover from an injury, or how to be able to improve whatever it is you're trying to improve in dance. There's other areas that we can help in performance too. So if, you know, you're in a competition like this week, or the Nutcracker, it's a big production we do in Missoula, you know, if you're experiencing a little bit of overuse from that increased time of really performing and doing things, we're there, we come, we provide consults. If we need to tape you up so you can finish your piece, we can help you do that part of things too, but know that you probably need to address what happened afterwards. Unless it's something that's fairly minor. But, you know that we're available for you guys in that realm, and we try to be within Missoula at a lot of the dance things that are going on so that we can help dancers be able to complete whatever it is that they need to do performance-wise. So we're there to help in that aspect as well. So that's kind of the role that I feel like we play, is just helping you to do what you do magically and beautifully, and to help you do it without hopefully further injuries or future injuries if you haven't had any, or get you back into doing it if you are struggling with something. So that's what we have. Does anybody here have questions for anybody on the panel?
I have a question.
Okay.
I probably should look at the sheet. You guys have times set up where you can do like 15-minute sections. Have they been all filled up, or do you still have time left?
I don't know yet. The sign-up sheets are backstage, and I haven't been over to the Denison to look yet. But yes, we are here today, tomorrow, and Friday. I'm here today, Anna's tomorrow, and I'm back again on Friday. And there are sign-ups back there for 15 minutes that if a dancer is struggling with something, and it doesn't have to be that they have an injury during this performance. By all means, it could be somebody just who has a question about anything that was discussed today or anything that they would like to know about their range of motion or something. They're more than welcome to sign up for the consult for that as well.
Where do those happen?
So Karen has this set up. If you go upstairs in the Denison, there's a balcony area, and we're going to be up there, so that way it's kind of private and not in the midst of everything else that's going on, but that's where the location is.
Thank you.
Yeah.
Well, I have a question, but I've got a little historical background to the whole stretching thing and why so little has kind of made it to the public. I was at the school where the research was done in the early 90s. William Bandy was a physical therapist out of the Texas Women's University. He was my professor. But his research didn't make it really to the journals until nearly about 2000. So we're just now 18 years after really this pretty significant first really good set of data in how to stretch. 15 to 30 seconds is what he came up with. He and his colleagues, there were other people involved. But so that's not even one generation yet passed. So we're all still just, stuff like this happens around the U.S. probably not often enough.
No.
I really want to thank you guys. This has been really good.
Yeah.
And I had something else, but I forgot.
We'll be around.
Anyway, thank you. That was all really, really good stuff. I've been dancing for 2 years, and this is just a nice sort of overlap.
I didn't see you working on your fifth.
I didn't have my tights
Oh,
on.
what an
I
excuse.
listened, and you said tights, and so I said.
Sorry, I don't care. I'll get you later.
Anyway, thank you again.
What happens if you have a teacher who's trying to force you to turn out in the wrong way?
Here's what I say is that sometimes you have to rethink what you think that teacher is saying. Sometimes it's not always that you think the teacher's telling you to do something that they're telling you to do. I think that is misunderstood a lot. So make sure you understand what it is the teacher's trying to tell you. If they're saying you're not in fifth enough, they might be saying you're lazy, you can do more, I see more from you. You know, that could be part of it. It really, you know, you've got to be careful with those words, force the turnout, or, yeah, I'd have to hear what the teacher's saying, and you have to hear what they're saying and see where they're coming from, but, you have anything to add?
I think that's beautiful. Because sometimes a teacher will be saying, where's your fifth, just because you're doing very sloppy jumps and you're not crossing your legs. They're not necessarily saying they want a flat, forced fifth. They just want you to complete with a little bit more care.
I mean, I would feel like from a physical therapist's perspective, we might help you understand what your potential would be and how to have a conversation
Yes.
with your instructor as well. And also, I've had conversations with the teachers.
Yeah.
Right? And I don't come from a dance background personally, so I love to work with teachers and say,
Yes.
what are you looking for? What does this need to look like? And I can help you understand whether that person's biomechanical alignment can actually get there.
That's right.
Or is it a strength deficit? Is it a mobility deficit? Is it a biomechanical deficit? No, that's not going to happen, okay? If they're really telling you to force your turnout,
You can say,
maybe a
well, it hurts my
conversation.
knees.
It hurts my knees. You tell them that it doesn't, tell them where and why it doesn't feel good. And that may help them understand that whatever cue they're giving you, even if they're intending to give you a good cue, isn't the right cue for you.
They might change what they're telling you.
They might change how they're telling you that.
Yeah.
I don't know if there's anybody else. I think I know what Jackson's talking about, but been in the room as a student with some of his teachers. And sadly enough, we actually are telling people to get it all the way sideways, and one of the teachers kind of, like if I was her teacher, I'd be like, in pain. She'd do the wiggly and the bend the knees and the scooch the hips forward, and that's what she was teaching them. So what I've told some of my students who come to me and say, well, this is what I'm told to do, what do we do? I'm like, well, are they gonna pay for your physical therapy when they hurt you? So I've told them, you don't get mad at your teacher, but just kindly say, it doesn't work for me. What do you guys think?
There's no student I know that's gonna go up and say to a teacher, that doesn't work for me. I would never do that. I would have no guts to do it to this day. I would just probably not come back to the class.
Yeah. I don't really know what to do when they ask me that. I feel kind of helpless.
You could provide them with some research.
Yeah.
I mean, not your opinion. I think that's one of the issues. We're talking a lot of opinions, right? So when we do start to have research that shows something about incidence of injury, which is really high when you start forcing turnout.
You could say, I've just had my physio assessment, and my physiotherapist has advised me to not work in a flat turnout until I have more strength.
That sounds good. I didn't know about it. Yeah.
And they're more than welcome. They
Have them call me.
they're willing to talk to you and explain why they've given me this program.
And I do with patients tell them if their dance teacher has questions, I am more than happy to talk to a dance teacher about what we're working on, and if there's a deficit or something that the teacher's wanting them to work on, like what we're doing to help them try to get to a certain point with things. I think that that is another role that we can play, is to help kind of.
I think we're dealing with a lot of dancers come down through the ages from word of mouth, and you now have information coming in from science and research, so some of it doesn't quite match up yet.
In addition, a lot of teachers feel when dancers are very young, their bodies are more moldable if you push them a little bit. I'm not disagreeing with that, depending on the age, depending what is inside of that dancer's turnout. So there's plenty of teachers that still say, push it, you can push it more. I can't disagree with that, because I've seen the dancers that don't hold on to it enough and do look sloppy. So, and it really depends on the body type.
Yeah.
A person that's so rotated and turned out is not going to get stronger until they learn to rotate parallel. Somebody that's really narrow hips and that already has the strength might have to hold it a little bit more, but their inner thighs are going to work already better for them, and the back of the legs are already going to work back of the legs for them. So maybe that teacher's like, that person's not going to get hurt if they push it a little bit more. So there's all those aspects to it. It's not just it's not generic for all people. It's different for who's in front of you. And are they holding their turnout when they leave the bar? Can they stand up without the bar and do the bar? That's what I do. And you can say nothing. Teach a class on top of the music without the bar, and you don't have to say anything as a teacher, because the corrections should be in the class. They should be in whether or not you're standing up and are successful as a dancer. That'll teach you. We were never given all this information, right? It was just do it. You did it or you didn't. They didn't tell us why or how. Why you not stretch feet? I don't know. Wasn't not like I was trying. Why you sickle your foot? They cut my hip off a few weeks ago. They put a new hip on, and now my foot don't sickle no more. After 58 years. How did that happen? Because the way they aligned it is now somewhat more correct. And I have no turnout. Oh. Literally. I woke up and I went, wait a minute, that foot's not sickling like it did for however 50 years or so. And was I yelled at by Baryshnikov? Oh, yes, I was.
I think that's a really good point, though, is looking at, do we know where the dysfunction's even coming from? I think that's one of the other things that we can help you figure out. If whatever they're picking on you about, if they're constantly picking on you for the same thing, maybe go get an individual assessment and sort of have that conversation. It doesn't really hurt, but I'm always told to suck my ribs in, or pull my butt under, or stop sickling my foot, or I don't have enough turnout. Those can be things that might also bring you into physical therapy. It doesn't have to be painful, because those less than ideal alignment issues will potentially, or likely will, lead to an injury somewhere along the chain eventually.
Every single correction she just said there, I could see fixing by how the person was standing.
Very much.
They don't need to tuck. They don't need to sickle.
And she's talking about starting from the core.
I'm talking about standing from
The floor,
Correct.
the floor, how you stand up,
How you stand, right.
how you walk, how you stand, how you speak. Stand in your truth. But exactly, yeah.
Timing and sequencing matters. How you get there matters.
Yep.
Any other questions?
If you see some of us and you want to ask us questions, at least for me, I'm here.
Yeah.
Have a lot of time here.
The iAdams website also has a whole, they have a teacher's bulletin that has a lot of
They have wonderful information.
wonderful articles written for teachers and dancers on stretching, on turnout, how to improve this, how to do that. There's lots of knowledge on that
And if
website.
you're interested in the research, there's the research, like I get the journal that's more for the medical
Yeah.
side of things as well, and there's tons of information in there, some really good studies, information.
Lisa Howell is one of my favorite. Lisa Howell.
Yeah, and Lisa Howell as
Lisa
well.
Howell.
The ballet
Write down
blog.
that name, Lisa Howell.
Ballet blog, she's also got a wealth of knowledge.
I didn't catch the name of the website.
H.
iAdams, IADMS.
A.
IA.
On the handouts that are over there.
DMS,
There's our website, and on our website, there's a link to their website too. Yeah. Yeah.
I'll get it.
Yeah.
Okay.
All right. Thank you guys for coming.